Hello, good afternoon. I'm Samina Gurung and with my group mate Tao, we are very excited to present our group proposal titled Smartwatch based innovation for people with dementia, a user-centered design approach. This initiative explores how wearable technology, specifically smartwatch, can help people living with dementia and reduces the burden of caregivers. To start with this presentation, I'd like to talk about dementia and its care challenges. Dementia is a progressive condition that impairs memory and cognitive function, leading to difficulties in performing everyday tasks. As the symptoms worsen, individuals often become more dependent on others. This places a significant emotional and physical strain on caregivers. While assistive technology offers some relief involving patients with dementia, but it is complex due to cognitive limitation and usability challenges. Thank you. Our project aims to develop a smartwatch-based innovation to assist with routine tasks. The key goals include improving the adherence of daily activities like hydration and cognitive engagement. We also aim to reduce caregivers' workload by automating reminders and monitoring vital signs. Finally, we will assess how expectable and usable the smartwatch is for people with mild and moderate dementia.
Hello everyone, my name is Thao and I will continue the presentations about the technologies overview. The core technologies is an interactive smartwatch that delivers prompts. This can be scheduled or figured by a caregiver. Prompt use vibrations, text, audio, or image, which is customized for cognitive and sensory limitations which is inspired by the SAMI study, and the watch will also collect data like heart rate, temperature, and SpO2 on scholars remotely via a caregiver's smartphone app. We aim to involve 30 to 40 older adults diagnosed with mild to moderate dementia. They use a smartwatch like Huawei Watch 2. Sensors like accelerometers will detect which motions, while touches locks will help us track interactions. Participants will receive two daily prompts, one for high vibrations and the other one for a simple cognitive task.
As we looked into the planned methodology for data analysis approach, we will use a mixed method approach. Quantitatively, we will look at the task completion rates and prompt response times. Qualitatively, we will use an adaptive system usability scale for dementia and conduct interviews with caregiver to get deeper insights. After applying the data analysis approach for the expected outcome, we expect over 60% adherence to tasks after prompt, indicating the technology is helpful and actionable. We also aim for a usability score of 75 or above and anticipate improved satisfaction and lower stress level among caregivers. Thank you.
Google measures how successful the research is by looking at different types of information. This includes data collected from the sensors, feedback and opinions from caregivers, and answers from surveys about how easy the technology is to use. And it is also very important to understand how well the participants learn to use the technologies. And we will also pay close attention to what caregiver thinks, especially if they feel that the technologies have the persons become more independent in their daily life. And about the timeline, in the first month, which will focus on getting approval to start the process. This includes making sure we follow on the rules for working with people, and we will also begin inviting participants to join the study. In months 1 and 2, we will work on building the technologies and making sure it works well with any other system we are using. Then in month 2 and 3, we will test the technologies in real-life settings and collect feedback and data from participants. And finally, in the 4 month, we will study on the results and write a report that explains what we learned from the project.
To conclude, our project demonstrates how smartwatches can be more than fitness tracker. It can be an empowering tool that help people with dementia maintain daily routines and a sense of independence. By focusing on user-centered design and real-time monitoring, we not only aim to enhance patient well-being but also reduce the everyday pressure faced by caregivers. This pilot study is a stepping stone. If results are promising, it will pave a way for more accessible and personalized dementia care technologies. Thank you.